Perception of supported self-care for users with chronic conditions in the context of primary healthcare by Tarsila Ferreira Bezerra, Bachelor of Nursing. Chronic non-communicable diseases are a global health problem and a threat to health and human development. One of the pillars in the search to respond more effectively to the needs of this problem, the model of attention to chronic conditions, was the implementation of supported self-care, since it aims to qualify and empower users for the self-management of their health. However, its applicability, especially in the Brazilian scenario, is still incipient, which motivated the development of this research. Objective: to investigate the perception of users with hypertension on the experience of supported self-care in the context of primary healthcare. A qualitative exploratory study was conducted for 12 months with 34 hypertensive patients who experienced the implementation of supported self-care based on individualized consultations and shared groups at a basic health unit of the Federal District Brazil between January and May 2019. For the collection of data, we adopted as strategy interviews with directed questions, namely, what is your opinion about care model based on supported self-care? Is there any difference between the supported self-care approach and the traditional approach? If so, please specify. How is it for you to put into practice the self-care plan? What's easy and what's difficult in practicing supported self-care? Do you think the self-care plan has offered any benefit to your life? If so, which ones? The interviews were recorded and transcribed in full. The corpus of the study, when analyzed, showed 76% of utilization, with 4,284 distinct forms or analyzable words, 90 selected elementary context units, from which emerged 3 classes that were correlated semantically. Class 1, Signs of Disruption of Medical-Centered Care and Recognition of the Benefits of Person-Centered Care, 44.44% of corpus. Class 3, Valuation of the Applicability of the Self-Care Plan, 31.12% of corpus. Class 2, The Behaviors Most Evidence for the Self-Management of Care, 24.44% of corpus. This qualitative research provoked in the user's imagination proposals of standard models essential to a collaborative and person-centered attention, to reach a change in the hegemonic medical culture that was not sufficiently effective to treat the chronic conditions. The valorization and empowerment of people in the care process resulted in different benefits, such as adherence to basic behaviors for health control, improvement of self-esteem, and quality of life. In this sense, it is concluded as promising to invest in methodologies that encourage self-management of care for the control of chronic conditions in the context of primary health care.